feedback. And this afternoon, I am going to give you a second talk about the diagnosis. Today's lecture is the physical exam of the head and neck. I'm Dr. Ying Lin from Sun Yat-sen Memorial Hospital. And the first part of today's talk is the physical examination of the head. The inspection is important and used for physical examination of head. This is because many traits or findings from the head, especially the face, is so attractively draw our attention when we firstly look at the patient. For example, the emotional reactions. Let's see. Expressive, unexpressive, if the patient shows keen or down. Nutritional status, pallor, puffness of the face, prephora, xanthoma, overgrowth of facial hair of a woman, and facial asymmetries, all highly suggestive for a particular illness. So, all of this will give you some clues and other indications for a diagnosis. A certain feature of observation or the integration of a set of findings will lead to an armchair diagnosis of the disease for an experienced physician. So, there's some magic for a physician. Some physician will give a very precise diagnosis when he or she integrates all the findings from physical examination and give a correct diagnosis in the old days. Nowadays, we have all kinds of lab tests, imaging, and all kinds of molecular diagnostic tests. But in the past days, we do not have this kind of high-tech techniques to detect the disease. But the basic techniques we need to grasp is that the physical examination, the ability you can identify the special symptoms, special signs, and the ability to integrate all these findings together and then to give a correct diagnosis. Let's see, the first part of inspection for the head is the general appearance, especially the appearance of the faces. First of all, from your textbook, you will see this kind of presentation. Deformities of the skull, what we call cranium. There are several special presentations of the deformity. One we call microcephaly. It's a congenitally small skull resulting from atrophy of the brain. And then the second thing we call macrocephalus is an abnormally large head due to hydrocephalus, such as Paget's disease and acromegaly, as I told you yesterday. And the third thing is the oxycephaly. We also call this liposkull, characterized by a long anterior-posterior axis, narrow in width and pointed at the vertex. So this is what we call liposkull. Let's see this general appearance from the thyrotoxic faces. These patients, they suffering the hyperthyroidism. They will show this kind of thyrotoxic faces. The patient is often thin and wasting, accompanied by an alert, startled, flushed, and anxious appearance. This kind of appearance from your first look, you may be able to suspect the patient may suffer from this Graves' disease. And the eye sign, besides the faces, the eye signs of Graves' disease is also very typical. And the patient may show a jet lag, a lead lag, sorry, not jet lag, a lead lag, the upper eyelid retraction, and then makes the exposure of the cornea, the sclera, the white part of the eyeball, and then the patient may have a widened picture, and you'll see the lead lag. When the patient look at you, you can see the white part of the sclera. This is the one Graves' eye sign. This is characterized by protrusion of one or both eyes, exophthalmos, associated with the retraction of the upper eyelids, what we call lead lag, which results in exposure of the white conjunctiva above the cornea, one Graves' sign. The other eye signs, including this eye signs, you guys need to read your textbook carefully to see different eye signs of the hyperthyroidism, including the Stelweg sign, Rosenberg sign, Min sign, Griffith's eye sign, Boston eye sign, Geoffroy, and Horner syndrome. All kinds of different eye signs will give you a clue for the diagnosis of the hyperthyroidism or Graves', especially the Graves' disease. And other general appearance I need to introduce to you guys is the cachectic or Hippocratic faces. This is characterized by sharp nose, sunken eyes, drooping eyelids, hollow temples and cheeks, dry, rotten skin, usually seen in highly wasting disease, such as the end-stage malignancy or the indicative of approaching death. So this is what we call in Chinese is the 恶业质, cachectic Hippocratic faces. Also, the face of hepatica, 肝病面容, is a thin face with sunken eyeballs, shallow complexion, and yellow conjunctiva, characteristic of a certain chronic disorder of the liver, especially liver cirrhosis. So this kind of patients will show a dark color, dark brown color of the skin in the faces. And the other general faces appearance is the Cushingoid face. This kind of patients suffering Cushing's disease. The features of the moon face, like the full moon faces, and plethora, acne, hirsutism, overgrowth. Hirsutism, the definition of hirsutism is the overgrowth of body hair, especially mustache, of a woman. So this is the typical appearance of Cushingoid faces. And next, I will introduce the mitral faces or mitral tricuspid faces. This means the appearance of the faces of some patients with mitral stenosis of long duration, marked by rosy, flushed cheeks and dilated capillaries, such as this. This is a patient suffering mitral stenosis for long duration. And then you see 二尖瓣面容, mitral faces. The other faces, including Cretin's disease faces, which means dull yellow appearance with thick lips, enlarged tongue, puffy eyelids, wrinkled forehead. And I will show you in the next slide. And then Nephritic faces, which means edematous eyelids, and pale appearance. This kind of patients also suffering from the kidney disease. And on the left is the creatine phases, and the right side is the nephritic phases. 呆小病肾病综合征面容。Also, this is from the textbook. On the right side, you can see this patient is a patient suffering Creatine's disease. And also, yesterday, I introduced acromegaly to you guys. And these are the acromegalic phases. A typical appearance characterized by a prominent forehead and large nose. This guy is a normal guy on the right side, and this guy have a enlarged tongue and noses, and this guy also have the similar appearance, what we call acromegalic faces. And other signs of the face I would like to introduce to you guys are including this: paralysis of the facial nerve, which means asymmetry of the faces, especially the loss of the normal nasolabial fold, indicating the paralysis of the facial nerve. These changes become most obvious if you let the patient try to smile or show his or her teeth, like this. For the normal time, the patient has a shallow nasolabial fold here, but when you ask the patients to show the teeth or like this, show the teeth, and then it shows more dramatically the disappearance of the nasolabial fold. So this is the indication of the paralysis of the left facial nerve. And the ability to wrinkle the patient's forehead on the aphatic side helps to identify the type of the lesion and how to distinguish. And this lady, if you ask her to wrinkle the forehead, you can see that she's not able to wrinkle her forehead on the aphatic side. So this is also paralysis of the facial nerve. So these are the general appearance of the faces. Besides this, I would like to talk something about the color and the pigmentation from the faces. The first thing I would like to introduce is the vitiligo, which means the absence of the pigmentation of the face skin occurring in patches, 白淀粉, the absence of pigmentation. And also sometimes you see some spots on some pregnancy women, the mask of the pregnancy, which means yellowish brown pigmentation symmetrically on the forehead, cheeks, and neck of some women during pregnancy or taking contraceptive pills due to hormonal changes. So these are the color and the pigmentation change from the faces. And if a patient have the hyperpigmentation all over, which is the appearing as diffuse brown, tan, and darkening of the facial skin, especially the unexposed parts, such as the gum, the buccal mucosa, or other areas, as the nipples, creases of the hand, and etc. And the patient may be weakness, fatigue, loss of appetite, and sometimes will have nausea, vomiting, and hypotension. This strongly points to the adrenocortical insufficiency, 肾上腺皮质功能不全. we have a name for this disease is the Addison's disease. So this kind of patient may show very dark. And let's see, these two guys on the left are normal pigmentation from the skin color, but these two on the right side are the patient at the hyperpigmentation and suffering the Addison's disease, the adrenal cortical insufficiency. And you can see that the hyperpigmentation is all over, including those unexposed body parts. And other signs I would like to introduce is the systemic lupus erythematosus, SLE. The skin lesions with the pigmentation, like facial rash, is distributed in a butterfly shape over the cheeks and the surfaces and the bridges of, and the bridge of the nose. You can see this. This is a SLE basis, the butterfly brushing from both cheeks and the bridge of the nose. And this is the presentation of SLE. So this is what we call SLE basis, the facial rash. And also, like yesterday, I introduced to you guys the jaundice, yellowish pigmentation. Mild degree of jaundice can be found by carefully check the sclera in daylight, may not be visible in artificial light. So we need to check carefully, especially for those with mild degree of jaundice. And we may need to ask the patient in the daylight environment to check the sclera. Jaundice should not be confused with carotenemia, which is resulting from excessive ingestion of carrots, or be secondary to increased serum levels of carotene in the setting of hypothyroidism and nephrosis. Some patients, they have the metabolic disorders, such as the hypothyroidism or the nephrosis. They may not be able to metabolize the carotene in the serum, and then excessive accumulation of carotene in the serum will show the carotenemia, and also is a yellowish screen, especially from the pads of the hand or the bottom of the feet. So this kind of yellowish skin should not be confused with jaundice. Cyanosis. This is an important point for today's talk. Cyanosis is a bluish cast to the skin that is easily seen in the tip of the nose, lips, cheeks, oral mucosa, conjunctiva, tongue, and the nail beds, especially caused by the increased amount of unoxygenated hemoglobin in the circulation from a number of critical situations. So cyanosis can be seen in the following situation, pathological situation. Okay, please remember this. This kind of clinical occurrence, these patients will show cyanosis. Sudden obstruction of the airway. The patient will be short of breath, and then the oxygenation of the hemoglobin decrease, and then the patient will show a bluish color, and then what we call this is the cyanosis, especially for those in the small kids. They have something obstruct the respiratory tract, especially the upper bigger respiratory lumen, and then the patient may show cyanosis immediately. And the second thing we need to know is the COPD. COPD means the chronic obstructive pulmonary disease, and this kind of patient is chronically ill and have the small respiratory tract lumens obstructed, show obstruction, and then also the oxygenation of the hemoglobin decrease. And the third clinical occurrence is the pneumonia, especially those with ARDS, like the critical SARS in 2003, and also the COVID-19 in earlier this year. This kind of patient have a pneumonia, and also they have the insufficiency or the dysfunction for the oxygen and for the exchange between the oxygen to the blood, and then the oxygenation of the hemoglobin decrease, and the patient shows cyanosis for this kind of pneumonia. Those patients suffering ARDS. And the fourth clinical occurrence is the heart failure, especially those suffering chronic heart failure. This kind of patient have heart disease, like the coronary artery disease and some congenital and other kinds of chronic heart failure. And typical heart disease I would like to introduce for the cyanosis is the congenital heart disease with the shunt of from right to left, from the right side of the heart to the left side, both the atrium or the ventricle shunt. So these 5 clinical situations will lead to the presentation of cyanosis in this kind of patients. Note that cyanosis may not occur in those patients that the hemoglobin is less than 5. If this kind of patient suffering anemia, even though all the hemoglobin became methemoglobin or subhemoglobin, 还原型的血红蛋白, and then show it because the low concentration of hemoglobin. This kind of patient may not have the color of bluish to show the cyanosis because they suffering anemia. Okay, so if the patient suffering anemia, they may not have a chance to show the cyanosis, or even though they are suffering this kind of clinical situation. So cyanosis is the key point. And then I would like to introduce the xanthoma. What is xanthoma? This is circumscribed, which means all or very round collections of lipid material in the eyelid. It could be flat or elevated, and a yellowish patch vary in size from 1 millimeter to 2 centimeters. Could be very small, or could be to a certain extent like 2 cm. This is associated with increased level of total cholesterol, or the patient suffering diabetes mellitus. So 中文 called 黄色瘤. So this is often found in the surrounding of the eyelids. Is the collection of lipid material. Okay, patients often have the increased level of total cholesterol. And besides the appearance, the face, I would like to talk something about the facial hair. Those patients have excessive growth of hormone-dependent hair, which means hair on cheeks or upper lip chin in women, suggesting hirsutism, 多毛症, and verified by associated androgenism, excessive production of the androgen, such as the increased level of male hormones, muscularity, and enlarging clitoris. So if you see excessive growth of the facial hair in a woman, and that may be some disorder for the endocrinology system. Okay, so this kind of patients may need to prescribe some lab tests for the hormone changes to find out why they have the excessive growth of the facial hair, maybe increased level of the androgen. And also, this can be seen in the androgen-secreting tumors, such as the polycystic ovaries, 多囊卵巢, and then also the adenoma carcinoma of the adrenal glands, 肾上腺癌或者腺瘤, can have the excessive androgen secreting. Also, the other drugs from outside the body, like the androgen contraceptive pills. If you guys remember the athletes, especially those female athletes, if they take too much androgen to have a very good record, very good results for the competition, for some games, and then the female athletes, sometimes they will take androgen. And this will show excessive hair growing, and also will hurt their body severely to some extent. So this is not a good thing. And sometimes they want to break the world record for a game, and then they will take drugs. And this will give you the clues to see if the androgen excessive situation. And in some situations, the patient may show loss of facial hair growth. What does this mean? In a man, if he's suffering the loss of facial hair, this implies some disorders related to hypogonadism. There are some different syndromes is associated to the hypogonadism. The Klinefelter syndrome, the Coleman syndrome, and also the hypopituitarism, 垂体功能低下, and after suffering some pathological conditions, such as the Sheehan's syndrome, 西汉综合征, excessive loss of blood from delivery to a kid, to a baby, and then the lack of blood supply to the pituitary gland, and then after recovery, the patient may suffer this hypopituitarism, and then they may show the loss of hair and loss of facial hair. And sometimes we can identify the loss of facial hair in the SLE patients. 眉毛稀疏, 头发稀少 can be found in the autoimmune disease. Okay, hypogonadism as well as the hypopituitarism. Okay, and other signs from the faces, including the nasal aisle flap, which means the short of breath, seen in acute obstruction of the airway in children, in asthma patients, and also the pneumonia and acute heart failure. 鼻翼扇动, nasal aisle flap, and also short of breath. And then this kind of patient not only showing the flap, but also showing cyanosis, as I introduced previously. for the obstruction of the airway, or the pneumonia, or the heart failure. Okay, and in our patient records, we need to record the characteristics of the nasal discharge, especially for the ENT doctors, to describe if the discharge thick or yellow, which means the patient may suffer from the infection of some bacteria or other pathogens. And other situations like the nasal sinus inflammation, and then this kind of patient may have the thick and yellow nasal discharge. The study of the oral or eye or ENT exam in details is available in related Department of Medicine, but today I just introduced the general examination to you. And before we are going to talk in the second part, this is also a key part for the head and neck physical examination. We may be able to take a short break. The content of today's talk is not that much, because only the examination of the head and neck, the content is less than yesterday. And I may be able to finish this talk earlier today. And then now, let's take a short break for about 10 to 15 minutes, and then we'll come back to talk about the physical examination of the neck. Okay. Let's take a short break.